Thank you, Governor. Good afternoon, everyone. Thanks for being with us today, and thank you in advance if you're able to join us as well tomorrow. We want you to clearly get the message that this is a critical period for us right now. This is our wake-up call. We are sounding the alarm because we can. We can do it ahead of time, and we can stop the trend that we are going in. Information right now is more powerful than ever, and we need you to join with us in doing things differently. To start with our data for today, we have 160 new cases to report. There are currently 131 people hospitalized across the state, 13 people in the intensive care unit, and 4 of those 13 people are on a ventilator. Sadly, as has been mentioned, we have 8 new COVID-19 associated fatalities to report. This brings our overall total to 1,147. 4 of the unfortunate fatalities occurred yesterday. Overall, 2 people were in their 60s, 1 person was in their 70s, 3 people were in their 80s, and 2 people were in their 90s. Our hearts and condolences continue to go out to the families impacted. As we've been doing each Wednesday, we have updated our school's data online. Please go ahead and check that out. As the governor shared, the K-12 community has generally been doing okay. The systems are working. We are not seeing big outbreaks of cases. It's something that we want to definitely continue in going forward. We've seen cases in schools as we fully expected, but our contact tracing and case investigation teams in the COVID unit at the Rhode Island Department of Health have been working around the clock to partner with schools, partner with RIDE, whenever situations have arisen. To school leaders, thank you for your leadership, and I want to reiterate that we are here to partner with you. So when thinking about taking a pause to go virtual for a day or two after having a number of cases, please consult with the Rhode Island Department of Health first. There are limited situations where that may be useful, and many times it isn't needed, and we can support you in how to go forward. So make sure to engage in that partnership. Also, to the school leaders, thank you for continuing to collect the information needed so that we can respond as quickly as possible. We have made general guidance available in our K-12 playbook so that people can be familiar with the roadmap of what happens when there are cases. And we have been working day and night in helping to ensure that people have the information that they need, that the calls that need to be made are being made, and to talk through specifics of the situations with you. I want to really say thank you to the teams of people who have been working tirelessly to help ensure that that happens. It truly is and must continue to be a partnership for us to continue to go forward as effectively as we have been with the K-12 community. Another reminder I want to share with school communities is that if someone in your household has symptoms of COVID-19, then everyone in your household needs to stay home. You should think about your immediate family or your household as one unit. If one child has symptoms of COVID-19, that child and any siblings in the house all need to stay home. If you, as the adult in the household, have symptoms of COVID-19, your kids cannot go to school that day. This is also applicable when it comes to work. If your child has symptoms of COVID-19, you cannot go to work. If your partner or spouse has symptoms of COVID-19, you also cannot go to work. This is what we refer to as quarantining. As a close contact, you're with someone who has symptoms, you need to stay home, not go to school, not go to work. That's because it can take time for symptoms to develop. You could have COVID-19 without knowing it, and it can take as long as 14 days for symptoms to surface. And a clear way to stop transmission from occurring out in public is if one individual in the household is sick, the other individuals in the household should stay home until there's further information about COVID-19 and what needs to be done. I know this is not easy, but we need people to take these steps if we're going to continue limiting disruption to schools and workplaces. And we know that it is possible. As the governor said, it's when we have those structured environments we can continue living with COVID-19 safely. While we're not seeing significant clusters, widespread cases in the school community, as the data show today, we know that we are seeing it as a state on the whole at the community level, widespread community activity. And that's where we're sounding the alarm and want to have you take steps differently. Since we were here last week, our daily case numbers ranged between 80s a day to more than 250 new cases in a day. While those numbers need to be considered alongside the increased number of tests that we're doing according to each day, those numbers of new cases in general are way too high. And knowing that it's in the community, it's not so much in K through 12, it's not so much in the congregate care, we need to act now about the community spread that we're highlighting. In our case investigations, we're seeing the same pattern time and time again. It's the pattern that the governor described. While we have done relatively well wearing masks out in public settings, people need to do better. If you're out and about, you always need to have your mask on. The added change now is also wearing masks in our comfort zones, in more familiar environments, when we're engaging with people that we know, family members, friends, co-workers. Those are scenarios where COVID-19 can still be transmitted, and that's where we are saying you need to continue to wear your mask in those settings. Even if it's someone outside of your household that you see every day or on a regular basis and you feel, oh, it's safe, they're not going to have COVID-19, that's exactly the time we need to continue to wear our masks. People are generally doing the right thing when around strangers in public in terms of mask wearing and distancing, but when it's around people that you know, that's where people are letting their guards down. And the whole point today is talking about bringing those guards back up. We need to stop transmission from occurring in those familiar associations scenarios. That's the people who are not complete strangers to you. On the one hand, they're your colleagues, your family member, a cousin, a neighbor, or anyone else you see regularly. That familiarity exists and is giving people a false sense of security. That's the shift that we need to make. COVID-19 does not care about that false sense of security. While people's guards are down, whether eating, relaxing, talking, their masks are not on, and the case counts have gone up. It's as simple as that. We need masks on to keep case counts down. We need to be wearing masks when we are around other people who we do not live with. That's true even when we're in our own homes. If you have a relative over, if grandma or auntie, or uncle is visiting, you both need to be wearing masks and keeping a distance. We need to figure out how to socially interact with each other in a COVID-19 safe way. And that means wearing a mask even in those familiar settings. That's the change that we need everyone to get on board with doing. Transmission is happening in informal, connected settings between people who know each other. And it's a glaring trend that we're seeing in our case investigations right now across the board. The governor shared the different scenarios already. It's whether it's with your coworker, in the break room, with a family member, in the house or in the yard, or with a friend or a loved one after a funeral or some form of life milestone celebration. In each of those situations, we must continue to wear our mask. COVID-19 does not care if it's an informal or connected setting where you know someone. And oftentimes, people do not have symptoms. That's what the key is, particularly younger members of our population, 20s, 30s, 40-year-olds. You may not have symptoms and have COVID-19. That's why we have to make this shift immediately now. If everyone can start doing this now, today, we can stem the tide. We have to stem the tide. For our most recent week of case investigation data, there were 1,033 cases identified. And to continue to share what else we're seeing in real time, of the people who were employed and who were positive or who tested positive for COVID-19, 60% still went to work at least one day with symptoms. That number is entirely too high. I'm telling you that a large proportion of people may test positive for COVID-19 and not even know because they don't have symptoms. Certainly, if symptoms are present in any way whatsoever, you need to stay home from work, you need to stay home from school, and anyone that lives in your household needs to do the same. There are supports available for people who cannot go to work. We recognize that that's challenging. It's financially challenging and otherwise. We want to provide the resources and support for you, because if you go to work sick because you need to, the challenges that can come from more people getting sick can be even harder than being able to stay home. So for more information on resources that are available to you, whether you're undocumented or someone who is unemployed or someone who is older and living by themselves, call us at 401-222-8022 so we can continue to get the resources available to you. The most important thing to remember is if you're experiencing symptoms, please stay home and make sure the members of your household do the same. The last thing I want to touch on before opening it up for questions is businesses and bars and restaurants in particular. The vast majority of businesses in Rhode Island are doing a phenomenal job serving customers in a way that is responsible and safe. I give kudos to you. We are grateful for that, and I'll reiterate what the governor said. Most of our spread is not happening in the retail and business community because of the structure that you have in place and the strong work that you're doing following your COVID-19 plans. To those business owners and to the employees at those businesses, thank you. However, I have to point out that there are some bars we are still seeing issues with. We no longer have the luxury of being patient with people who are putting others at risk by not following the rules. Since I was here last week, we issued immediate compliance orders to 4 bars because they were blatantly disregarding the Rhode Island's COVID-19 requirements. These orders temporarily closed those establishments completely. We have to be aggressive right now. We found bars operating after 11 p.m., mingling customers being served at bars, a failure to maintain separation at bars, and employees and patrons not wearing masks. Those are all of the examples that contribute to the increase in cases that are occurring. We need to wear masks. We need to keep our distance. Although restaurants can operate bars, they must close by 11 p.m., and patrons must be seated at bars with barriers between seated parties. It's that structure that decreases the risk of transmission. And nightclubs cannot operate in Rhode Island at this time, period. A business owner that's not following the requirements is hurting their entire industry. It's also jeopardizing the safety of customers and communities, and it's a small number of people. It's setting the whole state back in our work to prevent the spread of the virus. We are at a moment in our response to this virus when we absolutely need people following the rules. We will be back tomorrow, continuing to provide more information. There can be tip lines and ways that you can contact us so that we can all work together to make sure that we're following the rules out in public, as well as in our more familiar settings with loved ones, coworkers, and friends. It's about wearing that mask. That's how we can stop the transmission and keep each other safe.